So this is for anatomy physiology. This is chapter 9, part 2. We just finished talking about hemoglobin and how it's a protein. It's within the red blood cells, and this protein, hemoglobin, has 4 spots where it can bind 4 specific oxygen molecules. So here's some abnormalities of the production of red blood cells. Anemia is anything essentially where there's not enough red blood cells or hemoglobin. Quality can be affected, or quantity of the hemoglobin that affects red blood cells, causes low oxygen, essentially. Often, especially with females, it's iron deficiency anemia, so not enough iron in the diet. Because part of the heme molecule, or hemoglobin, it has an iron component. Autoimmune disease can cause anemia. Blood loss can cause anemia, lack of production of bone marrow. All those things can lead to anemia, not enough red blood cells or hemoglobin, so thus not enough oxygen. Polycythemia is the opposite of that, extra oxygen. So extra red blood cells, because more red blood cells would mean more hemoglobin, which would mean more oxygen. It normally occurs in responses of hypoxia. So when your body is lacking oxygen, it will cause more red blood cells to be made. Blood doping is a natural thing at high altitude. At high altitudes, you have less pressure to push the oxygen in your lungs, so it will cause your body to compensate by making more red blood cells. There's also illegal blood doping, in which you can get synthetic erythropoietin injected into you, or actually take your blood out and put it back in. COPD can cause polycythemia, even dehydration, overabundance of red blood cells. Iron deficiency anemia, like I said, is the most common, especially in females. 20% of all women childbearing age actually have iron deficiency anemia, which is quite high. I know myself, I'm anemic, so I have to take iron, and I see a big difference in my energy level when I don't take it. Hemorrhagic anemia is essentially caused by a lot of blood loss. So hematocrit is affected. That's the amount of red blood cell percentage, which means the hemoglobin is affected, and then red blood cell count. Sickle cell disease also causes a specific type of anemia called sickle cell anemia. It's inherited. It's autosomal recessive, so you have to get 2 recessive alleles, one from mom, one from dad, to get this. It's actually just a simple base mutation that causes sickle cell anemia. It causes the red blood cells that are normally frisbee shaped to become sickle shaped. You can see it here. Now, this might not seem like a big deal, but these red blood cells, like I talked about before, are designed specifically to carry the oxygen, to stack up on each other. So if they're not shaped appropriately, they're not going to be able to do what they need to do. They won't be able to perform their function. They can't bind oxygen as readily. They're not as flexible to fit through those capillaries. It's painful. The blood going through the blood vessels causes pain. And life expectancy is shortened due to sickle cell anemia. Red blood cells, like I said before, live about 120 days. So your body, to maintain normal mature red blood cells, we need to constantly be making more. Red blood cells must enter circulation at a stunning rate of 200 million per second. Okay, and in red blood cell production and destruction about equal each other. Your body actually recycles the parts of the red blood cells, and then kind of like dollar bills need to be taken out of circulation because they get old and ripped and used. Red blood cells also get torn apart, ripped, used, because squeezing through the capillaries is a tough job. So, and their parts are recycled. Phagocytic macrophages, which is a type of white blood cell, comes in the spleen and the liver, and they break down and recycle those parts, which is actually pretty cool. That graph shows that recycling process of the red blood cells. Okay, so red blood cell death. This is after it's been ingested by a phagocytic cell, white blood cell. It separates into globin and heme. The heme will eventually become a pigment. Two kinds of pigments: biliverdin and bilirubin. You can see this process here. It eventually leads to the liver, and then to the bone marrow. So all the parts are broken up. You can see some of it, parts are excreted in the large intestine and then in the urine. Have you heard of jaundice? Okay, so one of the components of blood cells is bilirubin, which causes a yellowish pigmentation. Newborns sometimes have a problem with jaundice because their body is producing red blood cells at too high of a rate for your liver, essentially, to recycle the worn out parts. So the pigment builds up in their skin, and they need UV direct light to break down that bilirubin. But after a while, their liver is functioning at capacity, and then their body naturally recycles the red blood cells appropriately. White blood cells, leukocytes, have a nucleus and a full complement of other organelles compared to red blood cells, but they don't contain hemoglobin, so their job is not to carry oxygen. They can be divided into two groups, granulocytes and agranulocytes. Granulocytes include the neutrophils, eosinophils, and basophils. In their cytoplasm, they have these granulations. So when you look at these eosinophils, basophils, and neutrophil underneath a microscope, they have like a grainy-like appearance. Agranulocytes, A without those granules, A means without, are your lymphocytes and your monocytes. So there's the two general categories that white blood cells can be grouped in. The most numerous white blood cell is your neutrophil. 60-70% of your circulating white blood cells are your neutrophils. And they look like this. They have a light pink staining. They are the main phagocytic cell. They're the first to arrive when you an infection. And so their principal role, their job, is to fight bacterial infections. This is kind of cool. Did I skip one? No, I didn't. So here's a white blood cell that's ingesting a microbe, like a bacteria cell. When these microbes are being ingested by these phagocytic cells, a phenomenon called chemotaxis comes into play. Chemo, chemicals, taxis come towards that area. So they release actually chemicals through this process that attracts even more white blood cells to that area to help take care of the debris or the bad stuff. Eosinophils, you can see it's a granulocyte. The granules stain like a darkish red color. Way less numerous, 2 to 4%. But with interesting allergic reactions, parasitic infections, the number of eosinophils increases in the circulating white blood cell count. So if you have a tapeworm, for example, somebody took your blood, you would have a higher percentage of circulating eosinophils, higher than 4%. Basophils, another granulocyte, and they stain like a purplish dark blue color. They contain histamine, so they're involved in allergy response. Normally they're the lowest circulating white blood cell, but they do have a role in the inflammatory response, which you can kind of hear Mrs. Coleman right now because I'm sick and my sinuses are plugged and I have some inflammation right now. Yeah, grosses, yeah. Okay, so the agranulocytes, one of the examples is a monocyte. They're another phagocytic cell, so they ingest foreign things like bacteria. That means they engulf it, phagocytic. A monocyte, you can see that they have a large nucleus. It kind of looks like a kidney. They're very numerous in peripheral tissues. Essentially, they just sit there. They're a fixed phagocyte. They just kind of wait for stuff to come to them. Example, in your liver, you have a lot of them. So the dead cells of the neutrophils and the monocytes, after they take them in, produces the dead debris formed in pus, which is kind of not very fun to talk Lymphocytes are the last of the type of the white blood cells. They don't have granulations, and here's a picture of them. You can see lymphocyte size is about that of a red blood cell. It's not much bigger. And the nucleus almost takes up the entire cell. They don't phagocytize things. They don't have granules. These are your B cells and your T cells. So some of them develop into very specific antibodies, which we'll talk about in the immune system. Normally, another name for a white blood cell is called a leukocyte, generally. Pardon me. Okay, so white blood cells are about 20 to 30%. This is still about lymphocytes. 20 to 30% are your lymphocytes. So they're the second most numerous behind neutrophils. If you have more than that, it's called lymphocytosis and represents an acute viral infection. So viral infection that just came upon you. They move along through your lymphoid tissue, so through your lymph nodes, back and forth between the fluids of the blood and the lymph. They don't just sit in the blood. They move around. And they're very, very important to the immune response. So somebody in a lab setting could count your white blood cells. And it tells you a lot about a person's health. Leukocytosis is any white blood cell count that's over 10,000 millimeters cubed. This indicates something like cancer, very infectious process. Leukopenia is an overall white blood cell count less than 5,000. And it could also indicate a problem, disease like AIDS, for example, that actually decreases the number of immune system cells. Bone marrow failure, so the bone marrow is not producing cells like it should. Severe malnutrition, or chemotherapy. And chemotherapy targets actively dividing cells like blood cells. But to make a white blood cell count more specific, you can do what's called a white blood cell differential. Instead of just looking at the total number of white blood cells, you look at the total number of neutrophils, the total number of lymphocytes, monocytes, eosinophils, basophils. Normally they should be in that level, but for instance, they could be higher or lower, and that could indicate a specific disease. For example, if you have an elevated number of neutrophils, that could indicate some kind of bacterial infection because they are largely involved in the getting rid of bacteria. A viral infection could, could be indicated by more the lymphocytes. So, this is interesting. This is a blood smear, so sample blood from somebody with cancer, leukemia. They have something called lymphocytic leukemia. White blood cell count over 150,000, and 90% of them are cancerous lymphocytes, those T cells. Plasma is that fluid compartment of the blood. Doesn't contain the formed elements. Water, electrolytes, hormones, proteins are going to be found, and other nutrients that are important to life. The main protein is albumin. Also has many clotting proteins like fibrinogen, antibodies, and then involved with immune response, enzymes. Globulin, alpha, beta, gamma, they are involved with the osmotic pressure. They are carrier molecules. Delta globulins or immunoglobulins, antibodies that are made by your B lymphocytes, and they eventually become plasma cells, which makes sense why they're in plasma. And that is the end. Part 2.